NIAB C516, cervical spine, pathoanatomical diagnosis, and illness script. We'll start this presentation with a few key quotes about decision making. These quotes serve to warn us about the pitfalls of complexity and simplicity in our differential diagnostic process. What we are ultimately out to find in our differential diagnostic process is the pathoanatomic diagnosis. This is our holy grail. The concept of pathoanatomic diagnosis is used by medicine and surgery, and it sticks to the basic tenet of orthopedic manual physical therapy that anatomy relates to function. Cyriax, in his selective tissue tension testing, uses a reasoning process that leads us to a pathoanatomic diagnosis. There are alternatives to the pathoanatomical diagnosis. Of course, there are clinical prediction rules, treatment-based systems, movement impairment systems, the disablement model, the associative approach. This patient looks like the last patient I saw that presented like this, so I'll use what I used last time. Or the infamous kitchen sink approach, popularized by novice therapists who will throw anything they can think of at a problem until something works. The disadvantages of this approach are that, particularly when we talk about the spine, we have difficulty placing our patients into recognized diagnostic patterns. There are many that fall outside of these patterns. In some conditions, the research supports treating based upon other systems. And as a means to maximize our ability to categorize patients, we will assign a pathomechanical or biomechanical dysfunction diagnosis to our list. This is the patient who responds best to orthopedic manual physical therapy. Illness or condition scripts have been used in medical education. It's an attempt to model expert problem solving. It involves pattern recognition and hypothesis testing. It's a way to convey experiential knowledge in a clinical manner, and it is a minimalist strategy attempting to use only key information that will be consequential to the differential diagnosis. The evidence on illness scripts is mixed. There are some limitations found due to bias. Some say it improves accuracy, and others recommend it is introduced early in the educational process. The essential illness script, a term I believe first coined by Jim Meadows, is an attempt to outline a unique cluster of identifiers for a condition. Ideally 3 to 6 elements from the history and subjective and objective exams. An illness script is dependent upon the experiences of the author. Here are some illness script examples for the cervical spine. Follow along, see if you can guess. How'd you do? Here's some more. Are you getting better? That was a harder one. This is the very general category that we talked about earlier. It's the kind of patient that we're really looking for. It's where orthopedic manual physical therapy can make the largest impact. With that moderate pain, limited referral, a directional, functional, and range of motion loss, pain is episodic or shorter in duration, and there is minimal functional loss. This is a rare phenomenon with limited literature available. Diagnosing it can be difficult, even with an MRI, unless you have specialized training. It is essentially the avulsion of the disc, typically on the anterior portion of the disc where it attaches to the end plate, usually due to a high velocity extension force. Remember, these illness scripts are only examples. They're dependent upon the author, and they're not universally agreed upon. They serve only as a guide.